My name is Jason Gill. I'm a family nurse practitioner student with ASU. My faculty mentors are Dr. Chris Jordan and Ms. Tanja Mead. My quality improvement project is a comparative analysis of influenza vaccination rates among COPD patients aged 60 to 70 years old. The influenza virus is a serious threat to global health, which impacts a multitude of people throughout the world each year. According to the Center for Disease Control, between 291,000 and 646,000 people globally will die from respiratory illnesses that are related to the seasonal flu virus. Much of this population that succumbs to the influenza-related illness has the potential to drastically reduce their mortality outcomes through the utilization of the seasonal influenza vaccination. The seasonal influenza virus is profoundly contagious and it spreads quickly by means of airborne droplets, which are circulated by coughing and sneezing. In the United States, COPD has ranked the third most common cause of death. COPD has been attributed as a significant cause of both morbidity and mortality, with an immense disease burden considering both primary and secondary care. Persons who live with COPD are especially susceptible to devastating outcomes produced by the seasonal influenza virus. The flu is one of the most common viral pathogens that are responsible for the exacerbation of COPD-related illnesses. While COPD is not a curable disease, it is treatable while keeping exacerbations to a minimum. The Global Initiative for Chronic Obstructive Lung Disease, or GOLD, advocates that the COPD patients receive their annual influenza vaccine. This is because seasonal vaccination of this population has been shown to have positive outcomes in reducing COPD exacerbations, hospitalizations, and mortality events. In addition to the GOLD recommendations, the vaccination among COPD patients, Healthy People 2020 has also set a goal for vaccination among this high-risk population, such as those with COPD. The goal of compliance among the COPD population is 90%. The vaccination rate for this population, though, however, is only 41% compliance. Previous research has demonstrated a high prevalence of the influenza virus among COPD patients experiencing an exacerbation, which is likely linked to morbidity and mortality. The purpose of this project is to compare the seasonal influenza vaccination rates of COPD patients at a local clinic in Prairie, Arkansas to that of the national average previously discussed, which is approximately 41%. This project uses a quantitative retrospective chart review to obtain information that is relative to the question of interest. Data was gathered at a local clinic in Prairie, Arkansas in order to compile the compliance rates of this local COPD patients. It's crucial for healthcare providers to educate and promote seasonal influenza vaccination among high-risk populations such as those living with COPD, as vaccination has been shown to be beneficial among this population. Approval for the project was granted through the Arkansas State University Institutional Review Board and the local clinic administration. Data reported from 21 patients whose matched inclusion criteria of age and ICD-10 code for COPD. The inclusion was that the patient had to be diagnosed with COPD and they were between the ages of 60 and 70 years old, while exclusions, patients who did not have a diagnosis of COPD and those patients who were younger than 60 or older than 70. While considering recommendations by Healthy People 2020, which set the influenza vaccination goal for high-risk patients at 90%, vaccination rates for COPD at this clinic have room for improvement. Based on provided research, annual influenza vaccinations have been shown to reduce the rates of both COPD exacerbations and mortality rates. Clinicians should be aware of the guidelines and recommendations for influenza vaccinations for all patients, but especially for high-risk patients such as those with COPD. Knowledge of risk of reduction of COPD patients through vaccination should be made available through healthcare providers so patient education can be implemented.